The role of medical director is a very broad one in the perspective that I find myself in here in TCP. It's quite varied. Obviously, we work with both public sector and private sector colleagues. In terms of our pharmaceutical colleagues, the role would very much be liaison in relation to contracts and indeed with other medical directors. And then around some of our contracts where we deliver antibiotic therapies and particular services to patients in the community, it's very much a clinical oversight role. It's also a clinical support role to the staff that we have within the organisation. Even though the patients that are referred out to us from hospitals are under the care of a referring physician, there are still many issues and incidents that arise on a daily basis that still need some guidance and attention from within the organisation. So it's also very much a coordination role. All of our nurses carry handheld devices, so at any moment in time they have the ability to write a summary of their findings, which will come back here as soon as it's synchronised, which means in real time, to our management control centre. And that information isn't just coming in and sitting somewhere. We have very real personnel sitting in place, reviewing that data as it comes in. Obviously, if there's a very acute issue with the patient, our nurse is going to take an action, be that to call an ambulance, call in to the referring clinician for further advice, or it may be something that's more subtle, in which case it will be picked up here by our senior nurse managers. And indeed, if there's confusion or a question, it can be escalated to myself. One very welcome part of the world that we live in is the amount of audit that we undergo, particularly from our pharmaceutical colleagues. These are absolutely welcomed because the learnings from that filter through the organisation to absolutely everything we do. We're also self-rigorous and we have a good schedule of internal audits yearly as well. This is a very busy time when you're doing audit on such a continual basis. With that in mind, TCP have invested in quality in a very real and meaningful way. Our quality department now consists of 3 full-time people, and indeed a good part of their work will be involved with audit.